Healthcare reforms. What are healthcare reforms? Healthcare reforms are basically when there is major change in the way that the country provides medical care for the population. The way that the country provides medical care for its citizens is determined by policies that the country uses in order to provide care for the population, and these policies are determined by the government and doctors union and representatives of the doctors union, and are discussed and are voted upon, and policies are being either rejected or accepted, and as a result will result in changes within the way that we pay for healthcare, or the way that the quality of healthcare, or how many people are being insured and covered by healthcare. So, what are some changes in the country that could determine the policies? What are some aspects that could determine the policies, or some factors that can affect it? So first of all, we can talk about the demographics of the population. If the population is aging, then we would need to increase the coverage of the insurance for more elderly population, because they are not usually able to work as well as the younger generation, and thus there should be some changes in the policies that would support these population. Another one is caring for the socioeconomically inferior people who are more do not have income, and these people, if these people are excluded from medical care, then that would be not so good, because it would reduce the amount of population that actually could be productive and actually help the country move forward. And we should also talk about that's the equality aspect of the healthcare, and we should also talk about things such as the number of insurance companies changing, or there's insurance company changes within those companies that will reflect changes within the policies as well, because there are some rules and regulations that are changes within the insurance company. We should also talk about the change in information, accessibility to information. So it comes back to people who are more socioeconomically well, people who are more connected to other people, who have more information from other people, tend to be more superior over the people who do have less information, have less connection with people concerning healthcare, and these population need to be included as well as in the policy making of the population. Next, we should also talk about the quality of healthcare. If, let's say, that the quality of healthcare is not as good, then that should definitely be in the policy, and they should definitely talk about it. Although there is a limit to what government can do, because the government are often influenced by companies and corporates and other major organizations that hold a lot of power and money, and a lot of policies can be determined by these as well. So it's definitely a thing to know. What are some things that are changed by policies? So policies can be changed because policies can affect pricing of our insurance. So it does affect the pricing of insurance and how much doctors are being paid, and how much pharmaceuticals will cost, and how much insurance we should pay, who we pay, when we pay, how much we pay, how much percentage of the healthcare that we pay, or things like that. We can also talk about change the quality of healthcare, such as for example, in the United States, there was the Accessibility Care Act that was done as part of Obamacare, and what this did was it sort of the whole idea of the Obamacare ACA was that it included more people, so it covered millions of people into insurance. Although there were still millions of people who weren't insured, this actually made a lot of millions of people gave millions of people insurance. As a result, it improved the healthcare of the country, and it basically what it affected things such as life expectancy or quality of life, this kind of thing. And it's very important that we talk about these things because at the end of the day, healthcare is meant for our population. It shouldn't, or at least it should promote equality and health towards people who are living in that country, in that society, and healthcare should allow people to make themselves more productive with their lives instead of hindering their ability to work, their ability to contribute, and as a result, these things should definitely be talked about within society and policies. So what are some things that we discussed in policy? What are some groups of people who are determining these policies? So first of all, we have government people, so people in the ministry, people working in the financing sector of the ministry, doctors' union, and then these things are very important because it doctors will usually increase the wages for themselves, and thus impacting the price, while government financing insurance companies will try to reduce the amount of money that's being spent so that it's more accessible to the population. Next, I want to talk about fraudulent use of these money. So, like I said earlier, corporates can impact these government heavily. A lot of policies in government that's being made are governed by major companies in the world, Google, Facebook, these things. And whenever these companies want certain policies to be made, or do not want a certain policy to be made, such as they don't want vaccination, then what happens is that these pharmaceutical companies can pressure the government to making policies and allowing vaccination to take place. And as a result, things like assassination could happen of presidents of certain countries, and these things can majorly affect policies that are being made. Also, like it said, 10% of the probably more than 10% of um, the insurance money, the money that's being collected for healthcare is being used uh, for things other than healthcare, and this